Yo guys, what is going on? JPS back with another video, and today we're going to be reacting to the healthcare system in Germany. As you all know, healthcare in the United States is a touchy topic and generally sparks a fiery debate between the two sides, one opposing free universal healthcare and the other being proponents of it. But we're going to be reacting to what the system is like in Germany. And so far, when I've checked out healthcare systems in other countries, namely Australia and United Kingdom, which isn't really a country, but anyways, I've always been really jealous, and a large amount of envy fills me when I see the healthcare systems that exist in other places, because I feel like what we're doing in the United States isn't good, just isn't good. So I have no background knowledge on what the healthcare is like in Germany or the healthcare system. So we're gonna get right into this. Hit the like button, guys. Hit subscribe, and let's go.
The last international healthcare system we covered, Singapore, got a great response from all of you. This week we head back to Europe. Specifically, we're going to Germany. Their universal healthcare system is based on the principles of Bismarck, which say that the state should provide only for those unable to provide for themselves. It's a private insurance system, and it's the topic of this week's Healthcare Triage. Health insurance is mandatory in Germany. Everyone has to get it. Before 2009, some of the richest people in Germany could choose not to buy insurance, but that's no longer the case. Insurance is sold only by nonprofit private companies. There are more than 130 of them, and they're also known as sickness funds.
Let's emphasize a key word: non-profit. A very key word. Big keyword.
Statutory health insurance, or SHI, or voluntary private health insurance, or PHI.
Okay.
PHI covers some of the benefits that SHI doesn't, but most are minor. It also gets you access to some better amenities and covers some co-pays for other services. 86% of Germans are covered by SHI and 11% by PHI. As with other universal systems, the insurance is pretty comprehensive. Coverage includes preventive services, hospitalizations, outpatient visits, prescription drugs, mental health, dental care, eye care, rehab, hospice care, physical therapy, even sick leave is covered. Long-term care is covered by a different insurance, but that's mandatory too. There are limits to this though, and some people buy supplemental private long-term care insurance. Any employed citizens and pensioners who make less than 52,200 euros a year and their dependents are covered by SHI. Anyone who makes more than that or who is self-employed can choose to get the SHI or buy PHI. About 3/4 of people choose the SHI path. There used to be no co-pays for SHI, but some were added in 2004. They were about 10 euros for a doctor's visit. But in 2013, most of those were removed again. There are still co-pays, 5 to 10 euros for prescriptions, but lots of drugs are still free, 10 euros a day for hospitalizations, and 5 to 10 euros for medical aids.
What type of copay is that?
Deductibles can vary by plan. There's no cost sharing at all for kids, and a cap on out-of-pocket payments at 2% of household income. That number is 1% if you have a chronic illness. Out-of-pocket spending accounts for just over 13% of all healthcare spending in Germany, making it slightly less than Canada, comparable to the US, but much more than France. About 72% of healthcare spending is public spending, and just over 57% comes from SHI. Employees or pensioners pay an 8.2% tax on their wages up to 47,250 euros. Wages above that are exempt from the tax. Employers contribute an additional 7.3% tax. The contributions are all put together and then spread out amongst the nonprofit SHI funds. If a fund runs low on money, it can charge the members a bit extra. In 2011, 13 of the 156 funds did so, to the tune of about 100 to 180 euros a year. PHIs are considered private health spending. There were 42 of them in 2011. Slightly more than half of them are for-profit. The other slightly less than half are non-profit. The premiums are risk-based on entry into the program, meaning that older and sicker people pay more. Employers make contributions to PHI as they do for SHI, but the employee contribution is higher. PHI is still tightly regulated by the government to protect consumers, though. Laws also encourage competition between the funds. Doctors belong to regional associations, which negotiate contracts with the various sickness funds. Outpatient docs work in private practice, for the most part, with 60% in solo practices, 25% in dual practices, and the rest in group practices. Mid-level practitioners, like physician assistants, are also employed in most offices. About half of physicians in SHI programs are family docs, and about half are specialists. Patients can choose any primary care physician, specialist, or hospital
It's really just blowing my mind so far. I mean,
that they like. There's no real gatekeeping mandate,
bro.
meaning that people can go to see specialists without first getting the permission of their primary care doctor. Although some funds do offer them, and offer incentives for using those gatekeeping functions. A relatively small number of people do, though. Most docs work in a fee-for-service way based on negotiated rates. There are preset maximum numbers of patients per practice, as well as reimbursement points per patient. This means that there are limits on the number of patients and number of treatments for which a doc can be paid each year. If a doctor goes over, they may not be paid.
That's so good because it sets like a standard. You're not rushing people. You're not rushing people like to meet a quota. Rather, you're not trying to meet that. You're trying to keep it on a schedule.
Half of all hospital beds are in nonprofit public hospitals. An additional third are in private nonprofit hands. The rest are for-profit, and that percentage has been growing. Most hospitals salary doctors who don't also work in the outpatient setting. The Federal Joint Committee decides what to cover and how to define quality. The Institute for Applied Quality Improvement and Research in Healthcare is responsible for quality assurance. Hospitals are mandated to report on 27 indicators so that they can be publicly compared. The country tries to control costs in a number of ways. There are a number of voluntary insurance schemes to do better disease management. Germany uses reference pricing with respect to drugs to try to get citizens to choose cheaper options. Basically, that means that the insurance will pay the amount of a cheapest drug in a class, and if patients want a more expensive one, they have to pay the difference themselves. A lot of research goes into deciding which drugs are most cost-effective. Finally, regional budgets are used to hold down spending. For instance, if a doctor goes over what's expected for prescriptions for their patients, they are held financially liable. In 2011, Germany spent $4,495 per capita on healthcare, or about 11.3% of GDP. That puts it on par with France. It's expensive, except for the US, which is insane at $8,508 per capita and 17.7% of GDP. But unlike some other countries, Germans have great access. More than 3/4 of Germans are able to get same-day or next-day appointments with their doctor, putting them at or near the top of the developed world. Quality is generally good.
That is insane. Like that's nuts. That's literally nuts. And look at that life expectancy. Look at us. We still haven't got over 80 yet.
Expectancy at birth is 81 years, making them 24th in the world. That's behind Singapore at 84, Canada at 82.5, and France at 82.3, but ahead of the UK at 81 and the US at 79.8. In infant mortality, it beats most, if not all, of those countries. Germany has an above-average number of physicians and nurses. They have a below-average number of CT and MRI scanners. Their preventable mortality rates are well below OECD average. A 2012 study found that Germany outperforms the United States and sometimes the UK in preventing death. It loses to France, though. Downsides? Because doctors are spread out so much, there can be gaps in knowledge about what patients have and what's been done. Surprisingly for Germans, it's somewhat inefficient. The fee-for-service model encourages more care, which some think goes too far. And some doctors hate the system, which can penalize them for doing too much. Germans worry that differences in physician salaries may lead to a primary care shortage in the future. Self-employed people also pay a lot for care since they're responsible both for the employer and employee contribution. Finally, some claim that systems that employ tiers of coverage, specifically the SHI and the PHI, often lead to the wealthy doing much better than the not wealthy. But it's worth noting that the vast majority of people choose the SHI option. What keeps
And it's also worth noting that makes complete sense. If you have more money, like, okay, let's not get into this because I know a lot of that is grounded in a specific type of, ideology, and it makes sense. Like you don't want people to be so well off to the point where there's this enormous inequalities, which we have in the United States, and it's all over the world. But at the same time, I still think there needs to be like this standard where it's like if someone is making more money, and I don't mean this in like a crazy way, I mean this in like if someone's making more money, yes, they're gonna be able to afford better care. Yes, they're gonna be living a better in quotes life because they're making more money. Like you see what I'm saying? Let me know if that's just the capitalist in me coming out and yelling at you guys, but I just don't really, and I'm all for like taxing them and trying to be as fair as possible, leveling the playing field, so to speak. But I just, when that type of language comes up, I get a little annoyed. It's like, of course they're going to be better off. They're rich. Like, what the hell did you expect?
Public and the private option so close in terms of quality, costs, and benefits? Likely it's the German government, and there's a lot to be said for it.
Okay. So I really like this video because although it's one source and I had no background knowledge of healthcare, so I'm taking it all with a grain of salt, of course. I'm not accepting this as the truth. But I really enjoyed this video because not only did he go through the different facets of German healthcare, but also at the end talking about what's wrong with the German healthcare system and some of the possible downfalls of it. From what I saw, though, the German healthcare system looks pretty damn good. A lot of funding. Maybe it's, not the cheapest thing, but it sounds pretty good. The fact that you can get same day or next day care, 75% of the population, that's insane. I mean, here we got backlogs for weeks. Like, literally, you have to plan things out so far ahead. So, really good video. I want to know, for those of you who live in Germany, what do you think of your healthcare system? Do you think it's good? And if you do, and if you don't think it's good, what's wrong with it? What do you think needs to change? And I'm sure many of you are asking me the same thing as I express my discontent for the United States healthcare system at the beginning of this video. And my unfortunate answer or response back to you would be, I don't know what needs to change, and I don't know if it's possible for healthcare change to come about in my lifetime, just because of the way our country runs and what it's founded in. Like, basically the beliefs that founded our country don't really bring about a universal healthcare system as an option, really, unfortunately. But yeah, I don't know. I had a lot of different ideas bouncing around there with the thing about the rich. Again, maybe I misinterpreted what was said there. That's just my personal opinion. If someone is rich, I believe that of course, they're going to have better healthcare. Of course, they're going to be able to afford the non-government subsidized healthcare system, get the private one, and go all out. Like, why would they not be able to? I don't know. That's a little weird to me. Like, there's a big difference there. So yeah, I think another video we're going to react to is the political parties and ideologies in Germany. Some of the different parties you guys would group yourself in, what you believe in, things like that. Because, again, healthcare is it's a really big political thing, political weapon in the United States. I don't know what it's like in Germany, but I think I'll be able to understand Germany and Germans a lot better, or at least bridge that gap a bit more if I understand where you guys are coming from on a political scale. So that's certainly a video you guys can watch out for. But yeah, that's about it for now, guys. Sorry for rambling a bit there. It seems like I kind of lost my train of thought and was going all over the place, but I appreciate you guys watching this. Hit the like button, hit subscribe, and I'll catch you all in the next one. Peace.